25 to 7 o'clock, the phone rings, a baby is born, lots of things happening in the doctor's office, and the doctor's in the house today. We have Dr. AdrianLorde as we have our doctor on the line. As you know, we will be taking your calls on 228-5562, 228-5563, an opportunity for you to get into the doc freely, really, this morning. Morning, Doc.
Morning, Peter.
Morning, Doc.
Good to see you.
Morning.
Hassle-free, according to Cassandra, hassle-free healthy eating. That's what we're going to be focusing on today.
Yes, that's a good idea to talk about that. Because sometimes people want to eat healthy, but they say it's too much hassle. They can't get this, can't get that. But it's easy, you know. Drink lots of fluids. You should eat 3 to 4 portions of fruit per day, and lots of vegetables. Cut down the oil and greasy things. Use a lot of fish. Not the fancy fish, the shrimp and so on may not be as healthy as others, and the fish should not be fried necessarily, and get some exercise.
Doc, you know, I'm a born skeptic when it comes to this, you know, easy, healthy eating thing. Who has time when they're on the road all day long, running from meeting to meeting, to have 3 portions of fruit?
Unfried. Unfried meat. Go ahead.
No, but seriously, walk me through how we can manage the healthy and the busy, because we're all busy on some level.
Yes, well, no, you need to plan ahead. So if you know you're going to be on the road a lot, then you need to know when to slot your eating habits, or, you know, it's not always easy to eat and drive, but I wouldn't recommend that either. But yeah, no, you need to plan ahead, and you know, you can have your fruit at breakfast before you leave home, and some of us leave home very early, and then you have some snack. When you're having that coffee break, it could be a fruit break.
You mentioned lots of fish. We have a caller. We're going to be coming to you very shortly, and there's a number on the screen. You can call 228-5562 or 63. But you mentioned fish in particular. Chicken is also supposed to be a good protein. Do you still recommend that?
Yes, of course. Chicken and fish are good proteins and low cholesterol type foods.
All right, let's find out about the question then.
Yes, let's take the call. Good morning.
Good morning. Hi, Doc.
Morning.
Good. How are you?
I'm fine, and you?
I'm good. How are you? Just kidding. Go ahead with your question. Go ahead with your question.
I have a 3-year-old daughter. She is constipated now for a week and a half. I have her on fruit and water, and I'm giving her lactulose, but nothing is still coming.
You said 2 or 3-year-old?
3.
Okay. Prunes.
Given what, prunes?
I just said that.
Yeah. Oh, you said, yeah. No. Sometimes a change in diet could affect young children, and sometimes it may just be that the milk that you're using. I think you mentioned something about lactose. Lactulose, right. So that's a better thing. Or soybean type, soya-based milk would be a lot healthier for that child.
But she does not drink formula.
Does not.
She's big now.
Yeah. Well, and the child is eating, so you need to give there again lots of fruit. Fruit will be good. Children don't like too much vegetables at that age, but fruit and fiber. Fruit has a lot of fiber in it, and that will help the bowels to move regularly. If having done that, there's still a problem, then that child should be examined by a doctor or pediatrician, because there are certain conditions, one called Hirschsprung's disease, which can cause constipation and which may need surgical intervention. So it's something that if that doesn't work, then you need to have it assessed to see if there's something more significant that may be happening.
Okay.
We have another call lined up. Good morning to Sophia.
Hi. Good morning, Doc.
Go ahead with your question.
Morning, everybody.
Morning.
Okay, I'm not pregnant because I had pregnancy test, but I'm having this white milky stuff coming out my breast. What's that?
Right, that is actually milk coming from what you have is a nipple discharge, and usually it happens when the prolactin level is high. Prolactin is a hormone that is released by the pituitary gland in the brain, and it is stimulated by the sucking reflex, which, if you were pregnant and breastfeeding, the sucking reflex, when the nipple is stimulated, can cause letdown of prolactin, causing the secretion of milk. One thing you should do is do not squeeze that nipple to check to see if there is milk, because that makes it more secreted. So don't check it all the time. But what we need to do is check and see if the prolactin level is high, because sometimes if you have a pituitary tumor or some abnormality or enlargement of the pituitary gland, that can cause increased secretion of the prolactin. It's usually associated with lack of periods or amenorrhea, a period of time where you have no periods. So sometimes that should be checked to make sure that that is all it is.
So go see the doctor.
See the doctor, get checked, and don't squeeze those
She
nipples.
must be scared though.
Yeah, you would be concerned if something like that is happening.
Somebody's pouring out when it shouldn't.
I think that's the point, when it shouldn't.
Sonia's holding on. Good morning, Sonia.
Morning, Sonia.
Morning.
Hi,
Yes.
go ahead with your question.
Dr. Lord, I find that when I'm walking, especially going up a hill, I can actually hear my knees giving a noise, like a kind of cracking noise.
Yes.
Can you tell me why is that?
Yeah, that is due to wear and tear of the cartilage, which is the lining in between the joint spaces, and that is all it probably is. It's due to wear and tear because of the excessive walking for long periods of time over the years.
Solution, doctor, because this is sounding like me. Solution.
No, exercising, doing some weight resistant exercising, push-up, press-ups, leg exercises, leg extensions, and so on to build up the muscles around the knee would help. And glucosamine is thought by some to help to regenerate the cartilage.
You don't
So
support
exercise.
Yeah.
They are coming in thick and fast this morning. Margaret's on the line. Good morning, Margaret.
Good morning, all.
Good morning. Welcome.
Dr. Lord,
Yes.
could you tell me what is gout and what causes it?
Gout is a type of arthritis where you get an increase in the level of uric acid. Uric acid is a level that is a substance that is broken down from increased protein use. Sometimes it can be caused from a number of different things. Eating a lot of protein, they say it's usually rich people's disease. It used to be said that, but you see it in any persons. But it classically occurs in the big toe. Why the big toe? I can't tell you, but it can occur in any joint, and these crystals develop and give you arthritis.
It's a very painful experience.
It's very painful, very, very painful. If you get a painful joint without any trauma, gout is a possibility. Okay. It can be treated with medication and cut down your alcohol. Sardines is one of the things that is high, that can cause it, and the high protein diet reduce that.
Reduce your protein diet, reduce the use of sardines,
alcohol,
and that should fix it?
That should help it, and then there's medication
if it becomes
taken
chronic,
to reduce that uric acid level.
Okay. We have someone else on the phone. Natalie, you're there. Good morning.
Hi, good morning. I'm trying to find out exactly what E. coli is and what symptoms are.
And what the symptoms are.
E. coli, Escherichia coli, is an organism that's usually found in the bowel. It's a normal organism, gut organism, but sometimes when there's an overgrowth of this, it can cause diarrhea or gastrointestinal disorders. Also, if the E. coli gets in the urinary tract, then that causes cystitis, and one of the most common causes is cystitis, or infection of the urinary bladder. You see it in women commonly, or sometimes in children who wipe in the wrong directions. So sometimes because of the moisture in the genital area, you can get germs coming from the buttocks area going into the urinary tract, and especially in the female, because the urinary tract is the urethra is very short in the female, and you can get this problem.
Right. So we're open to your questions. Those are the numbers on screen, 228-5562 or 63. But Doc, you came to tell us as well about eating healthy on the move, and you started that process.
Yes, Katrina.
We have established that you need to plan ahead, which is good advice. Can you suggest any foods that are good on the move foods? In other words, I wouldn't expect to roll up to a meeting in my car eating a Julie mango, as lovely as mangoes are.
Yes.
Can you recommend the foods that are healthy but that travel well?
English apple, well, the bananas might not travel well, but banana is also a good fruit that can be used. And there are several cherries. Beijing cherry is very good for vitamin C. So those type of fruits are quite available and easy to move with, and not too messy as
a box of raisins are good too.
Oh yes, raisins are good.
Are they filling? Because at the end of it, we just want to be full.
Well, and healthy, and not sluggish.
We just want to be full. We start there.
I love prawns.
Yeah, but
they now
it depends
come in
on your mind telling you what is full. If you're accustomed eating a big meal to get full, then that is so. But by reducing the meals and eating small amounts more regularly, then it's likely that you will feel satisfied.
All right.
They're filling, Pearson.
So we all say, I'll take your word for it. Fran is on the phone. Good morning.
Good morning.
Morning, Fran.
Good morning. I'm just calling to find out what causes feet swelling.
What causes? Did you hear her, Doc?
Something swell.
What is it, Fran? Say it again.
Feet swelling.
Foot swelling.
Okay. Yeah, most people when their feet start to swell, the first thing they think about bad kidneys. But usually it is used edema or just fluids accumulated due to gravity done by the
standing up a lot.
Yeah. Yes. So most people who stand up a lot will have some type of swelling at the end of the day naturally. When you go to bed, then that occurs. However, commonly in Barbados, if you're obese or if you have varicose veins, that can also cause swelling of the feet. Of course, if you have heart failure or kidney failure, you can have swelling of the feet as well, or some other injury if it's one foot. And I'm talking about the ankle, the lower leg. If it is one, then usually due to injury or some other local problem there.
Solutions: soak in some Epsom salt water.
Elevate.
No. Yeah, that's the old people's remedy.
Keep elevated. Also use proper footwear and stockings if necessary. The elastic stockings would help.
When you say proper footwear, are you talking at least with like a
short
reddish
heel.
low heel?
Yeah, low heel.
Something with cushion?
Yes, definitely.
Okay.
Ten minutes now to 7 o'clock. Our doctor is on the line, 228-5562, 228-5563. Dr. AdrianLorde is here with us. We did start our discussion on eating healthily, easily, and we're also taking your calls on 228-5562 and 63. Someone's on the line?
I think so.
Good morning.
Good morning, sir.
Good morning.
Morning.
Good morning to the panel.
Morning.
I have a question for Dr. Lorde, sir. Dr. Lorde, my daughter is 9 years old. I took her to the doctor yesterday. She was cramping pain in the shoulders and the knee. And they said that it is childhood pain. Can you please explain, sir, what does that mean?
She's having what in the shoulders?
Pain in the shoulders.
Pain in the shoulders and crying for a lot of pain in the knee. So
Knees.
yes, sir. I took her to the doctor.
Okay.
And they call it, you said they call
Childhood pain or probably growing pains.
Growing
Yeah.
Yes,
Yeah.
Can you please explain what's that, please?
Yeah, sometimes when the child is in the growing phase and she's at 9 now where she's becoming an adolescent, so some of the joints are, her body's getting bigger and some of the joints have not accommodated well to her frame and therefore it can cause some pain until things settle down. So obviously that doctor would have examined her, taken a proper history and come to that diagnosis that is just what we call growing pains. It's just an expansion or stretching of the ligaments and the joints and the bones as you get older.
How long does that last, doctor?
Well,
That's just a couple months?
Yeah, it could be months or it could be years because, she could go until the 11th in this sudden growth spurt or maybe after, depends on when her menstrual cycle starts and that kind of tells you.
So mommy and daughter are very concerned about this period of pain. What can they do to resolve that pain?
anything.
Yeah, just take some painkillers, the over-the-counter paracetamol, aspirin, or any other brands, just to treat it symptomatically.
So the good news is that it will go away.
It will go away. And if mommy remembers, she may have gone through it.
So it's
30 years ago.
I don't remember going through
I
a birth
do.
spurt
I
that
remember
caused
having
pain.
to go to the doctor because my chest was hurting, and the doctor said she doesn't have a heart problem.
All right, we got
She's
the
just
idea.
got growing pains.
We got the idea. Don't tell us the
Growing, her chest is growing.
No more.
Oh, we have another caller holding. Good morning.
Hi, good morning all.
Morning.
Morning.
Welcome. What's your question?
I have two questions actually. The first one being, I am addicted to wearing heels everywhere I go. Can heels, wearing heel shoes, affect your kidney? I often hear this. And the second one is I am also addicted to eating ice on a daily basis. Morning, noon, night, all during the day I want ice. All the time. Yeah.
Wow.
No. How old, what decade are you in?
I'm in
20s,
my
30s, 40s?
40s.
You're in your 40s?
Yes.
Okay, got it. Thank you.
Nice.
Just going with the thing with the ice thing, eating ice seems to be a problem. No, it's not a problem. It's not a medical problem. So eat as much ice as you want. It's just taking liquids. But if you should find out if you're excessively thirsty and if that is causing you to eat ice. But other than that, the habit is not a bad thing, and so eat it.
And now the heels and
The
the
heels.
kidneys.
Yeah, what she saying?
She often hears that it affects your kidneys, but she wears them every day. What is the harm in that?
No. There's no harm in wearing heels or no harm. Wearing high heels would not affect your kidneys at all. It might affect your lower back, where the kidneys are located. So maybe that is where you got the connection from, but it would not affect your kidneys in any way.
What are heel spurs?
Heel spurs are growth from bones within, especially in the foot, where from wear and tear and degeneration of the bones, you get a little outpoaching of the bone. That can cause some pain when it put pressures on the ligaments and other structures down there.
Okay. We have another caller. Good morning.
Good morning.
Hello.
Hi, good morning.
Good morning.
Good morning.
Go ahead with your question.
Hi, good morning, ma'am.
You can't listen to your television while you talk with us. You will become confused. Please ask the question, and then you can go listen.
Hi, good morning, ma'am. I'm calling about keloids.
Yes.
What causes keloids, sir?
Keloids are excessive growth of scars in the skin. It is where the body overreacts to a scar. In other words, you may get a cut, and the healing process, rather than stopping at what should be normal, you get an overgrowth of that. And it can be unsightly, it can cause pain and burning. It can be treated. If you are expecting surgery, then the doctor can inject a steroid to prevent it from occurring. If it does occur, you can also have injections to reduce that growth as well. So it can be treated, either prevented or treated if it is there by reducing the scar, or the scar can be removed and then drugs injected to prevent it from recurring.
Is it hereditary?
It may be hereditary. Getting scared?
No, no, I don't have that problem. I don't have that problem.
Okay, we'd like to welcome Caroline to the program. Good morning. You're live on the air.
Hi, good morning.
Morning,
I'm
Morning.
wondering, good morning to everybody. Like if you sit down for long periods of time and you get up and you have like these pains and needles in your feet all the time, is something wrong?
Not necessarily, but it maybe you're putting pressure on a nerve, the sciatic nerve, or you may be obstructing blood supply to a particular area, especially if you sit with your feet lapped in a particular way. That can sometimes cause it to occur. But you'll find that once you get up and move around, it goes away. So it should not be a problem at all.
All right. Onika, good morning to you.
Good morning to you.
Good morning.
I would like to ask the doctor a question.
Go ahead, please. You're alive.
I have been having problems with my medical sites from the time I turned a young lady. However, for the past 6 months, going on to 8 months, I haven't seen a period. Previously, they put me on the birth control pill. Every time I tend to gain weight when I use it. Is there anything that I can use that could, something that would prevent me gaining weight that would assist in this problem? Or do you think there can be something other than secondary medical?
Secondary amenorrhea is what the medical term. Where amenorrhea is lack of a period. And one of the most common causes of secondary amenorrhea is pregnancy, of course. But of course, I'm sure that has been ruled out. What she has is a hormonal problem where her ovaries are not secreting the estrogen as often as it should. If she's not desirous of becoming pregnant, it's not really a problem. But she should be evaluated to make sure that she doesn't have polycystic ovarian syndrome, which is a condition that can cause that to occur. But other than that, there are various hormones outside of the pill that can be used to regulate her periods if she wants to have a period every month. But you don't have to have a period every month.
You don't?
If it only comes when there's something there to bleed, or if there's no endometrium to shed.
Is that healthy?
Yeah, it is not unhealthy.
It's not
There's
unhealthy?
nothing in there you get a menstrual shedding.
You realize what you're saying to women the world
yes,
over?
and look at the television. It is not unhealthy not to have a period every month. There's nothing in there to pass out. To be shed.
Does that not suggest some sort of deficiency?
Yeah.
If my womb has not been preparing for the presence of a fetus, have I not been deficient in some way?
Not necessarily.
So nothing to worry about?
Nothing to worry about.
Okay, I have a quick question before we wrap up, Doc.
What does it mean for childbearing? Sorry.
Yeah, it would
He's not
affect
done
childbearing.
yet.
You can, if you find that there's a period of time you're going without a period, then the potential is that you will not be able to conceive.
It might be difficult. But
Okay.
other than that, there's no problem.
My question is over.
I can go ahead now? Okay. But quickly, doctor, you started out focusing on healthy eating. What is the right way to use protein shakes or meal replacement shakes in your program?
As a substitute after exercise to replace some of the muscles and so on that you may be broken down during exercise.
Okay.
Thanks for coming, Doc. As usual, you've shed some light on the many burning issues, both for our callers and for us around the table. We're talking about how to be healthy and sustain it on a schedule. We're going to talk next time, hopefully, about how to stay healthy during the busy crop over period.
Sure.
It's time now for our Nice Tip.
In our Nice Tip today, we ask you to be enthusiastic and knowledgeable about your company, your work, and your job. We talked about that this morning. Be enthusiastic and knowledgeable about your company, your work, and your job. In other words, have an interest in what you do. If you don't have an interest in what you do, then you will not be enthusiastic, nor will you find yourself seeking knowledge about the company, the work, or your job. So here's hoping that that's a nice tip for you today as you prepare to head into somebody's place of employment.